Hello, welcome to demola, and today I'm going to be talking about my experience in preclinical years of medical school. So I'm going into my third year now, and in Manchester, the first 2 years are all preclinical. So you're based in the university, and you're learning like core concepts such as your bioscience in terms of how is that going to make you to be a better doctor. So now that I've gone through the preclinical years, I'm just going to answer a couple questions today, hopefully giving you a bit more insight into what it's like as a preclinical medical student, a bit of advice, and then hopefully if you're thinking about applying to medical school or even applying to Manchester in particular, this hopefully can help you out. So we're gonna get straight into it now. How does university medicine compare to A-levels? Now, I'm sure if you're applying to medicine, you're already gonna know it is a difficult degree. And I think when I was in first year, something that I would always say to my friends is, it was like having a whole term of work condensed into 1 week. Which sounds crazy right now, but I promise you, when you get your grades, when you get into medical school, it is possible. But there's definitely a lot more expectation on you to kind of learn these things. And I would say in general, compared to A-level, there's less support. Like, you're not gonna have your teacher on your back telling you that you need to revise this and that. There's not a specification for a medical school. So for Manchester, they gave us ILOs, which is intended learning outcomes. And you would kind of have like a list of things, but it would be quite broad. So that kind of encourages you to do a bit more wider research, to explore a bit more about what they want you to learn in the week. So it's definitely less structured compared to your A-levels. But I also think having that freedom helps you to become more of an independent learner, which sounds like a buzzword, but genuinely, I think it is really nice having a bit more autonomy about when do I want to revise, how do I want to revise, for example. So in terms of university versus A-level, I think the main differences would be, one, you're going to have a lot more work to do. Two, you're going to have to be a bit more disciplined with yourself. Like you need to tell yourself, okay, I need to revise this. And to be honest, sometimes it does kind of feel like what am I meant to be learning this week? But it is something that you kind of get used to and just adapt to in it. So that would be my kind of, what's the main difference between learning at university compared to learning in A-levels. What is the workload like in preclinical years? Okay, I think there was a big disparity between first year and second year in terms of the workload, right? So, again, we're not going to beat around the bush. You do have a lot more work to do compared to your A-levels. But I would say maybe in terms of revision hours per week, I tended to do about 6 per day on the weekdays, which is, if we do 6 times 5. So on the weekdays, I would do like 30 hours of revision. And then on the weekend, maybe I'd add in another, sometimes it was 10 to be fair, depending on when. But if we add in like another 6 or so, I would say maybe about 35 hours a week I would spend revising. I think the workload, it can get really difficult if you don't do things on time. So like, for example, in Manchester, you've got a weekly case and the next week you're moving on to the next case and it's like that. So for example, say you end up in like week 4 and you're still on week 2's work, you're gonna feel like there's a lot more work to do compared to if you were doing it as you go. So I think a lot of it is dependent on your own time management and how well you do that. It's definitely possible to manage, that's what I would say. It's definitely possible, but it's gonna take a bit more effort on your part compared to when you were doing A-levels. Yeah, that's what I kind of want to say. In Manchester, we were fortunate enough, we got reading weeks. So like, sometimes it would be like every 3 weeks that you'd get a week off and you get to just catch up on the work. So that was really good. If you felt like you fell a bit behind, you can cover that content again in that week off and then go again. So I think the workload is a lot, but they give you, Manchester give you more than enough time to revise. Our course is like, I think this year I only had like about 10 hours of teaching per week. So the rest of that time, and that's why you've got to be disciplined yourself because there's a lot of time, but the rest of that time you can use to manage your revision. So I'd say the workload is a lot, but it is very possible to manage if you know how to manage your time well. Okay, teaching styles. This is very university specific, right? So for Manchester, they do PBL, peer-based learning, or TBL, team-based learning, but you kind of have a group of people and you have your case and you study that together. So like, we would have a group of 5 or 6. At the end of each week on the Friday, we get together We get questions on the case and we discuss through it together, seeing what we've learned in the week and kind of building off ideas like that. So very much a more peer-based approach, right? Some medical schools are going to be more lecture-based. So like, for example, I think it's Oxford and Cambridge that do a traditional style, where it's mainly like you're learning in lectures. Obviously, I haven't done this, so I don't know exactly. But you're learning more in lectures. Some of them I heard is like inquiry-based, where you're having to ask more questions, or even some are just called case-based, where you're doing a case each week and you're using that to learn. So it's very much medical school dependent on how they teach you. If I delve in a bit more into what Manchester do, for example, in each week we're going to have 2 anatomy sessions. So one's with a tutorial, one of them we get to go to the dissection room, look at a couple of the post sections and some of the cadavers that they have there. Something else that we do is communication skills, which I thought was fantastic, by the way. Really loved it. Where we get to practice with actors about how we're going to speak to patients and learn like different techniques in terms of how to do that more effectively. Another thing that we had was physiology, pharmacology, where we're learning key skills like taking blood pressure readings, performing CPR, etc. So you do have a lot of different approaches that you are going to use to learn. Very medical school dependent, right? But I've just shared a bit of an insight into all the different ways that we learned at Manchester, and it helps you to become a more complete doctor in a way. So I was really happy with the amount of different styles that Manchester allowed us to do. Assessment. Okay, so obviously you come to medical school, they're gonna assess you. Now, medical school is a bit different to your other university degrees, whereas you don't get a first class, a 2-1 or a 2-2, something like that. It's literally just pass or fail. So it's all dependent. Did you pass your exams at the end of the year? Okay, then you can move on to the next year, right? In Manchester, I don't know if it's the same with other medical schools as well, but we did have, so you'd have your low pass, that means you've passed, satisfactory, honours, distinction, right? So there are ways that you can get better grades per se, but the main aim is to pass. What kind of things did we do, right? So we had this progress test. I don't know if other medical schools do this, right? But it's like all 5 years of the course will do exactly the same exam. So like, as a preclinical student, you go in, you get C, you move on, right? I've heard some people in my cohort would revise for those exams and they do really well. So fair play to them. I would say that's not just words. That's not necessarily something that you have to do, but definitely if you're really passionate about it, go for it 100%. There's no shame in doing that. The other things that we would have is semester exams. So your semester exam, everything that you've learned in the semester, you were tested on that. So I think Sem 1 was about life cycle. Sem 2 was cardiorespiratory. Sem 3 was brain neurology. And Sem 4 was about gastrointestinal. So literally all the cases, all the different conditions that you've learned the physiology about, you're being tested on that in your semester exam. And then something that Manchester did, which I heard not other medical schools do in preclinical years, is CCAs. So they're clinical competency assessment, or you might have heard them called OSCEs. Right? So I kind of see these as like acting exams where I get myself into doctor mode, right? And I just have to try and, I feel like the key to that is you kind of got a fake confidence, like you got to believe that you are that guy, essentially. So, for example, you're speaking to patients, trying to make up a diagnosis, taking a blood pressure reading, for example. And in your preclinical years at Manchester, you also would do anatomy. So that's kind of just a taste of what assessment is like. I would say in general, they are obviously going to be really stressful. In preclinical years, in Manchester at least, many people would take the progress test too seriously. But in terms of semester exam, getting all that content from the beginning of the semester is going to be difficult, right? And also the CCA, it's a lot of pressure because you only have 6 minutes per station and it does go by really, really quick. So assessment is obviously going to be difficult, but that's a bit of insight into what Manchester do. Just some additional stuff that we had. We had PPD, something like professional development, personal professional development, right? Where you had an advisor, mine was lovely. You get to talk to them about different stuff and write a bunch of reflections. I think they changed it so you don't have to pass that to progress, but it is actually really good and I personally enjoyed making all those reflections. And we had PEP. So PEP is something excellence program. I'm so sorry I've butchered it, but it's excellence program where like in first year you would make a group poster, in second year you would do a 500-word essay. So that's a bit of an insight into how they do assessment in Manchester. When do you get clinical experience? I think we've all come into medical school wanting to be doctors, right? At least you would hope. So your clinical experience is quite important, even though you are mainly preclinical, at least in the first 2, maybe sometimes 3 years. So it does vary again from medical school to medical school. Like, I've talked to some friends where they were getting put in GPs every single week. I've talked to some friends where they haven't had anything at all in like that first year, for example. But what Manchester did is first year in semester 2, we would have 2 GP placements. So you get your GP partner and you go with them to the hospital placement if they come. If they come, you go to them to the hospital placement, the GP, and you just kind of get to ask questions, kind of see how they're going. If the GP is nice enough as well, they'll let you do something with the patient. So like, for example, they might let you do a consultation, or they might like you to take a blood pressure reading or something like that. So definitely really useful having those. I found them okay. Some were more boring than others, but it was okay overall. Then in semester 3, when you get into second year, you have 2 GP and you have 2 hospital. So the hospital placements, I found them to be a blast. Like, really, really interesting getting to go into the hospital, talk to a bunch of different patients, hear their stories, and like, it's so different compared to what we would do each week with simulated patients, because obviously they're working from a script. When you're getting someone who's telling their whole life story, like that 70-year-old patient, they're going through their whole life story, you're going to realize so much about them, and it is really, really nice connecting with patients in that way. So I really enjoyed hospital placements. Again, not too many. When you get to Sem 4 in year 2, the second semester, you get 2 more hospital placements. And your hospital placements, instead of just going with one other person, you go with your whole TBL group and another TBL group. So I did find them quite useful, and I really enjoyed the hospital ones in particular. But clinical experiences, obviously it's hard to schedule in from the uni's perspective, so can't ask for too much, but I really did enjoy that they at least let us to be able to get into that environment a bit in our preclinical years, because it is a different way of learning, and a way of learning that I actually really liked. So yeah, that's all for me. What was the most difficult part about preclinical years? If you're in Manchester, it will be Sem 3, yeah? But if you get into Manchester, the second you land in, people are going to be telling you about how difficult Sem 3 is, right? It's mainly because, first of all, it's neurology, which is typically really difficult. And then also, it's because you've got to do 2 anatomies a week. So you'll have one anatomy that's like about like a lot of the major structures like brain and the neck, and then one that's a bit more almost like physiology, where you're learning stuff like, I'm going to throw a big one out there, basal ganglia, stuff like that. So Sem 3 in particular was quite difficult just because of the amount of content that you had to learn. But in terms of what I think is the most difficult thing about preclinical years is, especially in first year, you get in and you have no clue how to revise. Like, I think first year, especially the first semester, it's a lot about experimentation, about how do I think I want to learn, and is it actually going to be effective in the long run as a method that I want to continue using. So like, for example, some of my friends use Notion, some of my friends do question banks, some will do Anki's, Quizlets. It is very, some even revise from notes, so it's like, it's very much dependent on you about how you want to revise. But I think that probably was the most difficult part, especially when you come in, and I'm telling you, imposter syndrome is so real. Like, no matter how good you are in A-level, there's going to be someone that is better than you, yeah? And I think it ends up making you kind of feel like, what am I doing here, right? But trust me, you're meant to be there, yeah? For me, literally, in my first week, I was telling my flatmate, like, maybe, do I need to go off and do biochemistry? Because I didn't think that I was going to be able to cope with the medicine. But you do get used to it, push through it, it will get better. So I think kind of just learning how to revise, it was the most difficult bit about preclinical years. Balancing study with social life. Guys, I say this a lot whenever I do these type of videos, but guys, you've got to always take care of yourself. Learn how to rest, yeah? It's really, really, really important to not treat yourself like a robot and keep going at it. So you can 100% have a social life and be a medical student. I think a lot of people come in with this misconception that you're a medical student, you're going to be revising constantly, which is true. You're going to have to do a lot of revision, but you can enjoy yourself. Like, I'm not someone who goes out too much or drinks per se, But I know a lot of my friends that every single weekend not even every single week they can go to the club, they can go to the bar, they can hang out with their friends. Like, you do have enough time to enjoy yourself in medical school. If someone says that you don't, it's a lie. Yeah. Not even just like meeting up with friends. You can easily do that. Like, that's why I feel like it's such a misconception that even I had when I went to uni. Like, guys, I'm gonna be in that library 24/7, but you literally don't have to be, right? You can enjoy your life whilst being a medical student. So I guess I'm glad to confirm that for you. Societies in uni is a big one. You always have time for societies. Like, in first year, I was doing futsal and not badminton, futsal and dodgeball. Year 2, I was doing badminton and football. So it's like, I'm having time to do that. I'm able to go to the gym about like 3-4 times a week. And I'm able to spend time with my friends if I want to. So you do have enough time to socialize in medical school. Really, really important that you remember to do that as well. What is my best advice for new medical students? Don't put too much pressure on yourself. Like, I think it's so easy to come into medical school and think that you've got to be the top dog, or you've got to be able to, like, guys, you know, in A-levels, I'm sure all of you were smashing it, like getting like 90s, 80%. Some of you would have maybe even got like 100%. But when you get to medical school, that can drop, and I mean drop very drastically. So it's like in medical school, a lot of the time you end up with these people that a lot of people are just happy to pass, like happy to get like 50%. So you do need to kind of cut yourself a bit of slack, because it is difficult content, and especially when you're coming in first year, you don't really know how to revise yet. It is a bit of a struggle. So don't be too stressed if there's some guy like at the top of the class still smashing and getting 80%. Make sure that you're focusing on how you personally can get better. So don't worry too much about comparing yourself to other people. Also, just be a nice person. Like, be willing to share your resources with other people. It shouldn't be you shouldn't be fighting against other people in your medical school. Like, help each other out. Make sure that all of you become great doctors in the future. Genuinely, I think the best advice as a medical student coming in is just relax. Yeah, leave the ego at the door. Relax. Learn to enjoy yourself as well. Really important. And also make sure that whilst you're enjoying yourself, you're meeting new friends. And also, don't forget, you are in university, so make sure that you are learning as well alongside that. But definitely don't neglect your social life. I think it's really easy to do as a medical student, and it's really easy to get into this mindset that you have to beat everyone. No, you don't. Yeah? So just learn to kind of take it a bit easier on yourself. Like, you don't need to put too much pressure on yourself when you're coming into medical school. Just be open to learning. Like, you're gonna learn so much new things when you're in medical school. That is gonna be my best advice if you're coming into medical school. What do I wish I knew before I started medical school? Coming from somebody who doesn't have like any doctors in the family or anything like that, I think the one main thing that I wish I did know was just about seeking opportunities outside of medical school. Like, I have a bunch of friends that are literally like LinkedIn warriors. They know who they are. LinkedIn warriors, and honestly, seeing what they do just outside of medicine, so like going to all these different conferences, doing presentations, it genuinely is so inspiring to me. And I wish it's something that I knew I should be looking at before I started medical school, because it does set you up really well for when you start doing applications for your speciality training. So I definitely think looking at opportunities to enhance your learning outside of medical school, whether it's conferences, whether it's webinars or anything like that, is really, really important. On top of that, societies, like, thankfully for me, I actually did get into a society for second year, but I was thinking, like, in first year, I was like, why would I join a society? Like, it's just gonna add more onto my plate. But genuinely, I was so happy that I joined a society. Like, I was on the African Caribbean Medics Society in my university. So I think just kind of being more open to these experiences outside of just the medical school, so outside of just the learning, just being open to those kind of things, I think was something that I wish I was prepared to do before I started. Because now I'm coming into third year realizing that, okay, I probably do need to start doing more of these things. Like, I need to start building up my LinkedIn. I need to start going to more conferences and stuff like that. I wish I did know that before I started, but it's fine. You know, you're always learning. I'm a young buck, so it's good that I've got time to learn that now. But maybe if I was more prepared to do that, I could have got maybe a jump on it, like with internships and stuff like that. That would have been really helpful as well to know. So that would be my best advice. Just make sure that you're not thinking linearly on, I've just got to pass these 5 years. Think about beyond that. So like with your speciality training, what kind of things can I do now that are going to help to support that application? Whether it's joining a specific society, whether it's going to some conferences, because you do have time to do that in your preclinical years. Does become, probably in all fairness, it will become more relevant in clinical years, but I think just being aware of it in preclinical years would have helped me out a lot more, because I kind of was just figuring it out as I went. What I regret most about preclinical years, deeper one. So I've kind of been preaching this sermon, but I didn't necessarily listen to my own advice in it. My main regret is probably doing too much in terms of like revision. So like, I think a lot of my regrets come more from year one compared to year two. I was actually really happy with how year two went overall, and like starting this YouTube channel, it's something that I think shows about how I've kind of grown throughout university in terms of like developing my confidence and stuff. My main regrets coming from year one mostly is, first of all, about not being confident enough. Like, for example, there will be times that are asking questions. I do know what the answer is, but it's like I'm too afraid to kind of show that in a way. Like, so that was definitely one thing. Another thing was just about like, generally, I don't know why I was like this, but like sometimes I see my snap memories. I'm like, I was in the library at what time? Like, I was in the library on my birthday. Like, and too bad I did that in second year as well. But like, that kind of stuff that I didn't need to do while I was doing too much, and to the grace of God alone, like, I have gotten good grades throughout medical school so far. But then also, especially in that first semester of first year, I was pushing myself so hard to a point where I wasn't actually enjoying it. Like, there are so many events that I didn't go to because I was like, no, I'm going to revise as well because I need to get this done by the end of the week. And like, sure, it's admirable, you got the grades and blah, blah, blah. But it's like, university is meant to be something that when I look back at the end of the 5 years, I want to say, I have this amazing memory with my friend here. I have this amazing memory with my friend there. I'm meeting new people all the time. So I think in terms of regrets, that was my main regret, about pushing myself so hard to a point where I wasn't enjoying uni, especially in my first semester. And thank God it got better. Like, second semester, I was like, at demola, you're making friends and you're doing it now, yeah? So I did get to connect a lot more with people in the second semester, and I did go out more, spend more time with my friends. So that was probably the main thing that I was regretting from medical school. Just to summarize, it was pushing myself too hard at the beginning and then not enjoying my uni experience. But then also putting so much pressure on myself to a point where I was like, what are you doing? Like, yeah, and the second thing was confidence. Brain black, yeah. It was about confidence. Like, I do very much think I'm becoming one of those people that always say that they're shy, and then you're like, oh, like, get a load of this guy. But generally, I believe at least that I was a really, really shy person, maybe even prior to second year. Now I'm doing things like running teaching events, being on societies, doing YouTube. So I'm really grateful to God about that development. But I just think all that being shy, not really speaking much, not going out much, it did kind of put a taint on what could have been a really good first year at uni. So yeah, that's my main regret from preclinical years thus far. Again, not really related to learning, but yeah, hopefully that gives you a bit of insight. Okay, and that is a wrap on our video. So I've just been answering 10 questions about my preclinical experience in university. I hope it's really been helpful to get an insight into how I found it, and hopefully that can be something that you can use to think about more about, okay, now I've heard this about Manchester Medical School, maybe I want to apply there. Now that I've heard this from a medical student, that gives me a bit more insight into what I can expect going into medical school. So please feel free to subscribe, like the video, leave any questions in the comments below. I'm going to do my best to answer them as well, in addition to what I've said here. So I hope this video has been really helpful, and I'll catch you in the next one. Bye for now.